Blood pump IV tubing can be confusing to both hook up and flush appropriately. It was designed to administer blood products to a patient. That's why you have two IV ports on the top and a filter in the drip chamber. We use this line for several reasons. First, when hung by gravity, our blood pump tubing flows faster than our standard IV lines. So, when we are establishing an IV line, primarily for fluid administration, for patients that are in shock or dehydrated, the blood pump tubing is our go-to line. It also has a squeeze bulb with a one-way valve that allows us to force fluid to the patient under pressure. This can be helpful to administer fluid faster in an emergency. It can also be used to help administer adenosine, which needs to get to the heart in a few short seconds. While all this is helpful, it makes this line that much more difficult to flush and hang appropriately. If the pump chamber on the blood tubing is not filled appropriately, we could potentially administer a large amount of air into the patient's vein. So that is why it is imperative that you practice this skill and make sure that you know how to flush this line appropriately when time is of the essence. Braun Ultrasight Y-type blood set is the current blood tube set that South Metro Fire carries. It comes with several components: 2 IV bag connectors, 3 roller locks, a blood filter drip chamber, 30 cc hand pump, and multiple injection sites. There are a couple things to remember about blood pump tubing. The cap at the end of the line maintains sterility. The line will flush with the cap in place. There's never a reason to remove the cap. It's also highly recommended to add an extension set to the end of the IV line. That way, If you have any problems with the line, it is easier to disconnect the line from the patient and correct the problem. When flushing our standard single chamber IV lines, if you get fluid from one end to the other, it is basically safe to use on a patient. That is not the case with blood pump tubing. After flushing the line, it is a good idea to give your line a visual inspection, especially the pump chamber, to make sure that you don't have any large amounts of air still remaining in the line. If you are unable to successfully flush the line, the worst thing that you can do is to leave your line hanging, where it can be mistaken for a properly flushed line and accidentally hooked to your patient. If you see air in the line, or if you suspect that there is air in the line, ask for help or discard the IV. Once air has been introduced into the blood pump tubing, it is almost impossible to get it out. At this point, it's probably just easier to discard the line and start fresh.